Let's dive right into a huge question today. Why is healthcare so unbelievably expensive? I mean, it's a puzzle that affects literally billions of people. And the answer, it turns out, tells us a whole lot about how we value health itself. So, to kick things off, we're going to look at the country that spends more than any other.
Right. Let's get to the heart of it. We have to start with the biggest spender on the planet, the United States. Their healthcare system costs more than any other, and it's not even close. So the big glaring question is, why?
And when I say it's not close, I mean just look at this. Way back in 2000, the US was already spending over $4,600 for every single person. That's a whopping 44% higher than Switzerland, the next country on the list, and more than double the median for other developed nations. It is a true, undeniable outlier.
But here's where it gets really weird. This is the paradox. You think with all that extra cash flying around, Americans must be using more healthcare, right? Going to the doctor more? Nope. The data actually shows the opposite. The US is below the median for things like doctor visits and days spent in the hospital. So, they spend way more money, but seem to use fewer services. How on earth is that possible?
Well, a really famous paper in the journal Health Affairs just came right out and said it. They put it bluntly. After crunching all the numbers, the researchers basically concluded it's not that Americans get more care, it's that the care they do get, every doctor visit, every hospital stay, every prescription, simply costs much, much more.
So prices and economic incentives are clearly these incredibly powerful forces. And to really understand just how powerful they can be, we can look at a massive real-world experiment. And for that, we turn to China, which for about 3 decades went through one of the most unbelievable healthcare transformations in modern history.
You see, before 1978, China's system was what you'd call centrally planned. It was state-funded, and the whole idea was built on this principle of equal access for everyone. But after 1978, as the country opened up its economy, everything changed. The system was totally reformed into one that was heavily market-based, driven by private money and, you guessed it, the pursuit of profit.
And this table just lays it out so clearly. The entire goal of the system went from equal access for all to revenue generation. The financing flipped from being government-funded to coming straight out of individuals' pockets. And how doctors got paid? Well, that went from a fixed salary to a system of bonuses that were tied directly to the profits they could make for their hospitals. A total 180.
And the financial impact of that shift? It was immediate, and it was dramatic. You can see it right here in this chart. The burden of paying for healthcare just moved away from the government and social programs and landed squarely on individual patients. That rising line, that's families paying more and more and more out of their own savings.
So what happens when you start treating healthcare like any other business? Well, the fallout was pretty severe. Suddenly, huge financial barriers kept millions of people from getting the care they needed. The gap between the city and the countryside grew wider and wider. And since doctors were now paid based on profits, they had a pretty strong incentive to order expensive tests and high-tech procedures, what economists call physician-induced demand. Meanwhile, basic, unprofitable stuff like preventative medicine, it was pretty much ignored.
Now, this total reliance on people paying out of pocket, it can have absolutely devastating consequences, especially for the most vulnerable among us. We've seen the big picture in the US and China, but to really feel the human impact, we need to zoom in one last time, all the way to a rural province in Cambodia. Okay, just imagine your child gets sick with dengue fever. Where you decide to go for help can literally determine your family's entire financial future. During one epidemic, the average cost at a well-run public hospital was just $8. But for families who went to private providers, the average bill was $103. That is a staggering, life-altering amount of money in a place where many people live on less than $1 a day.
So how in the world do you pay for that? Well, many families had no choice but to borrow from moneylenders. And this number right here, 10%, get this, that was a common monthly interest rate on those loans. Some people were paying as high as 15% a month. It's a debt trap that is just almost impossible to climb out of.
The ways families tried to cope were just desperate. They would burn through every penny of their life savings. They'd sell off food and other things they needed to get by. They took on those insane high-interest loans. And in the most tragic cases, they sold off the very things they needed to survive in the future, productive assets like their farmland.
It's an impossible choice, as the researchers who documented this story wrote. Just think about what this means. In the face of a loved one's illness, families literally sacrifice their long-term stability, the well-being of everyone in the household, just to get immediate care for one single person.
Okay, so let's zoom back out. What does this all mean when you put it all together? We've gone from the multi-trillion-dollar US system to China's gigantic market experiment and all the way down to a single family's medical bill in Cambodia. It's time to connect the dots.
So what are the really crucial takeaways here? First, remember the US. It's the sky-high prices, not overuse, that are driving that runaway spending. Second, as China's massive experiment shows us, when you treat healthcare like a simple market commodity, you can create huge problems with access and fairness. Third, on the ground in places like Cambodia, those out-of-pocket costs aren't just numbers on a spreadsheet. They are a devastating poverty trap. And finally, the common thread through all of this is that economic incentives matter. A lot. They powerfully shape how doctors and hospitals behave, for better or for worse.
Which leaves us with one last question to really think about. A commodity is just something you buy and sell, like coffee or oil. But if health is treated in exactly the same way, what are we really paying for? And maybe more importantly, who is it that ultimately pays the price? Thanks for tuning in.